Hi, my name is Gustavo Mendoza, and I am the Health and Wellness Coordinator at Kanban Communities. And today I'm presenting Eating and Moving with Arthritis. What is arthritis? Arthritis is joint inflammation, and rheumatic diseases are inflammatory diseases that cause your immune system to attack your joints, muscles, bones, and organs. The two most common is osteoarthritis and rheumatoid arthritis. Osteoarthritis is a progressive, local, degenerative joint disease affecting one or more multiple joints that breaks down cartilage. Most common form of arthritis, it's the fastest growing cause of disability worldwide. It's most commonly in hands, hips, spine, and knees. Risk factors include being overweight or obesity, history of joint injury or surgery, genetic predisposition, and aging. Rheumatoid arthritis is a chronic systemic inflammatory autoimmune disease of unknown etiology. Inflammation in the joint lining, bony erosions, and systemically muscle loss, fat gain, accelerated atherosclerosis. Other common rheumatic diseases include fibromyalgia and gout. Arthritis in the US. Arthritis and other rheumatic diseases are the leading cause of disability in the US. 23% of US adults report having a doctor's diagnosis of arthritis, of which about 43% complain of arthritis-related physical activity limitations. By 2040, an estimated 26% or 78 million US adults are projected to have a doctor diagnosed arthritis. In 2013, the total medical costs and earning losses due to arthritis were 304 billion, or about 1% of GDP. The average medical cost per person with arthritis is $2,117. Do I have arthritis? Risk of arthritis. The risk of arthritis increases with age. Almost half of all adults with heart disease also have arthritis, and almost half of all adults with diabetes also have arthritis. And almost 1/3 of all adults who are obese also have arthritis. Only a health, four warning signs are that. And again, only a healthcare professional can tell you for sure if your joint symptoms are actually arthritis, but the four warning signs are pain, swelling, stiffness, and difficulty moving a joint. For pain, pain from arthritis can be constant or it may come and go. It may occur when at rest or while moving, and pain may be in one part of the body or in many different parts. Swelling. Some types of arthritis can cause the skin over the infected joint to become red and swollen, feeling warm to the touch. Swelling that lasts for 3 days or longer or occurs more than 3 times a month should prompt a visit to the doctor. Stiffness. This is the classic arthritis symptom, especially when waking up in the morning or after sitting for a long time. Morning stiffness that lasts longer than an hour is good reason to suspect arthritis. And difficulty moving a joint. It shouldn't be that hard or painful to get up from your chair. And before visiting the doctor, keep track of your symptoms for a few weeks. Notice what is swollen and stiff and how long and what helps ease the symptoms. Managing arthritis. Using self-management skills to make healthy lifestyle choices and to learn how to manage physical and emotional effects of arthritis can help take control of your arthritis. Some self-management skills are be organized, keep track of symptoms, pain levels, medications, and possible side effects so that you and your doctor can determine what's best for you. Manage pain. You don't want pain to take over your life, so there are some 8 natural pain therapies. Acupuncture, which it is designed to stimulate nerves, muscles, and connective tissues, improve blood flow, and activate the body's natural painkillers. There's massage, a gentle manipulation with moderate pressure, and has been shown to reduce joint pain and stiffness, along with improving range of motion. Tai Chi, a Chinese practice that combines gentle flowing movements, deep breathing, and meditation. Yoga, an Indian practice that uses deep breathing, meditation, and body poses. Weight loss, losing 1 pound removes 4 pounds of pressure on swollen, painful joints. Physical therapy, physical therapists can provide different ways to reduce strain and pressure on painful, swollen joints. They can also recommend assistive devices like braces and splints to support joints. Topical gels, these gels work by stimulating sensory nerve endings in the skin, and the body responds by reducing pain signals through the nervous system. And then TENS. Trans, Transcutaneous electrical stimulation is a form of electrical stimulation to relieve pain. Now, going back to our self-management skills of address the emotional side, some steps to take are doing what you can to keep negative emotions away through physical and emotional self-care, like mind-body practice, music and art therapy, and a healthful diet and exercise. Getting involved in social activities to prevent feelings of isolation. Working with your doctor to get your disease under control and minimize medication side effects, and seeking out professional counseling or arthritis-specific support groups to give an outlet to talk about your emotions and provide you with coping mechanisms. Tackle fatigue. So using vitamins if nutrition is poor to fill in the nutritional gaps and better your overall health. Moving. Exercise helps fight fatigue through increasing blood circulation and muscle mass, and the body releases endorphins that produce a sense of well-being and vitality. And hydrate. Dehydration is a hidden source of fatigue. The average person needs 8 8-ounce glasses or a half a gallon of water each day, usually. Eat well, feeding our body with good whole foods, plenty of fruits and vegetables, lean protein, and healthful fats. Always begin each day with breakfast that includes protein to provide long lasting energy. And then our mind. If depression or stress is contributing to your fatigue, then seeing a therapist, cognitive behavioral therapy, and mind body exercises like Tai Chi and yoga can help calm your minds. Take breaks, stay active, but rest between activities. For muscles to refuel for more activity, rest is needed. And sleep. Sleep hygiene is important for recovery. Avoid alcohol, nicotine, and caffeine before bed because this can disrupt sleep. Going to bed at the same time every night and getting up at the same time every morning. Keep your room cool, dark, and comfortable. And then turn off your computer, cell phone, and television an hour before bed. And that's to improve our sleep, to keep a regular schedule. Again, waking up at consistent times. Most people need 6 to 8 hours of sleep each night. And a sleep diary. Write down your habits for a couple of weeks, like when you wake up and go to bed, any naps, how much caffeine and alcohol that you had that day, medications, and even stressful events that happened that day. Moving more. Research shows that those who are more active sleep better. And the power down. Again, turn off your electronic devices 1 hour before bed. Digital devices make it harder for us to wind down. Research has shown that the artificial light from the devices interfere with the sleep hormones in the brain. Avoid caffeine and alcohol. A morning cup of coffee shouldn't affect your sleep at night, but stick with water in the afternoons and evenings. And you may even limit your fluid intake to avoid middle of the night bathroom trips. Coffee and soda and tea have caffeine that stimulates the brain and makes us feel more awake. Use a bed. Use your bedroom as a safe haven for sleep. Don't use your bed to eat in, write emails in, or watch TV. And then treat stress. Use relaxation techniques and exercise like Tai Chi and yoga. And if you can't sleep after a half hour, get up and read in a comfortable chair. And then possibly a sleep study. If changing habits don't seem to help, consider a sleep study. The study can help you diagnose problems such as sleep apnea and sleepwalking. And then balance activity with rest, part of our self-management skills. Rest is important when your disease is active and your joints are swollen and stiff. Lighten your schedule and ask for help when you need it. Pace yourself throughout the day and take breaks when you can. Eat a balanced diet. Healthy eating plus exercise can help you reach and keep a healthy weight. Add foods that are anti-inflammatory, which are high in antioxidants to help control inflammation. Get moving. Exercise helps strengthen muscles that will help support joints and keep them mobile as well. Exercise also helps lose excess weight, which helps take pressure and stress off the joints. Ultimate arthritis diet. Now, there is no miracle diet for arthritis, but there are some foods that can help fight inflammation and improve joint symptoms. A diet rich in fruits, vegetables, fish, and nuts and beans, but low in processed foods and saturated fats, is great for overall health and can help manage disease activity. These principles are the same as the Mediterranean diet. The benefits of the Mediterranean diet are that studies confirm that eating foods commonly part of the Mediterranean diet can do the following: help arthritis by limiting inflammation, benefit your joints as well as your heart, lowers blood pressure, protects against chronic conditions ranging from stroke to cancer, and leads to weight loss, which can lessen joint pain. Now, part of the Mediterranean diet is the fish, and so some types of fish are a good source of inflammation fighting omega-3 fatty acids. Some of the best sources are salmon, tuna, sardines, herring, anchovies, scallops, and other cold water fish. About 3 to 4 ounces of fish twice a week is what we should be taking in. And if you don't like fish, studies show that taking 600 to 1,000 milligrams of fish oil daily eases joint stiffness, tenderness, pain, and swelling. Now onto the nuts and seeds. Nuts are filled with inflammation fighting monounsaturated fat. Although they are relatively high in fat and calories, nuts promote weight loss through the protein, fiber, and monounsaturated fats, which are satisfying or satiating. A recent study has found that subjects with lower levels of vitamin B6, which is in most nuts, had higher levels of inflammatory markers. Some of the best sources are walnuts, pine nuts, pistachios, and almonds. 1.5 ounces of nuts daily, or about 1 ounce, is about a handful. Fruits and vegetables. Research has shown that citrus fruits like oranges and grapefruits, which are rich in vitamin C, prevent inflammation and maintain healthy joints. And vegetables rich in vitamin K like broccoli, spinach, and kale and cabbage dramatically reduce inflammatory markers in the blood. Some of the best sources are colorful fruits and vegetables. The darker and more brilliant the color, the more antioxidants it has. Blueberries, cherries, spinach, kale, and broccoli. 9 or more servings daily, and one serving is about equal to 1 cup of most fruits and vegetables and 2 cups for raw leafy greens. Olive oil. Olive oil is packed with heart-healthy fats as well as allocanthal, which has similar properties to non-steroidal anti-inflammatory drugs or NSAIDs, and that diminishes the body's inflammatory process and reduces pain sensitivity. Some of the best sources are extra virgin olive oil because it goes through less refining and processing, so it holds more nutrients. There's also avocado and safflower oil, which has shown cholesterol lowering properties, and walnut oil, which has 10 times the omega-3s that olive oil has. On to beans. Beans are full of fiber and phytonutrients, chemicals, compounds in the plants. Some of the best sources are small red beans, pinto beans, and red kidney beans. About 1 cup twice a week or more. Whole grains. Whole grains contain plenty of fiber, which helps maintain a healthy weight. Some studies have shown that fiber and fiber-rich foods can lower blood levels of CRP, an inflammatory marker. CRP is C-reactive protein, and when levels in the blood increase, there is a condition causing inflammation somewhere in the body. Some of the best sources are whole wheat flour, oatmeal, bulgur, brown rice, and quinoa because they are made with the entire grain kernel. Some people need to be careful about which grains they eat because of gluten, which is a protein found in wheat and other grains. Gluten has been linked to inflammation for people with celiac disease or gluten sensitivity. So about 6 ounces of grains per day, or at least three, should be from at least 6 ounces of grains per day, and at least three of those should be from whole grains. 1 ounce of whole grain should be equal to about a half a cup of cooked brown rice or about one slice of whole wheat bread. And now nightshade vegetables. Nightshade vegetables include tomatoes, eggplant, potatoes, and red bell peppers, which are disease-fighting powerhouses that has maximum nutrition for minimal calories. They also contain solanine, a chemical that has been branded the culprit in arthritis pain, although no significant evidence shows that nightshade triggers arthritis flares. Now, some top anti-inflammatory foods are salmon, tuna, sardines, and mackerel. The studies have shown that these fish are rich in omega-3 fatty acids, which decrease inflammation. One way to make it more affordable is by doing frozen fish or canned sardines, salmon, and tuna, and to make sure to use low sodium options. And berries, apples, and pomegranates. Berries are rich in antioxidants. Fresh, frozen, or dehydrated berries still give plenty of health benefits. Apples are a good source of fiber and also high in antioxidants. Pomegranates are rich in tannins, which fight the inflammation of arthritis. Vegetables. Anti-inflammatory vegetables like cauliflower, mushrooms, Brussels sprouts, and broccoli are beneficial in either fresh or frozen form. Canola and olive oils. They are a good balance of omega-3 and omega-6 acids, which both are essential fatty acids. Ginger and turmeric, chemicals in these plants are known to have anti-inflammatory properties. And nuts, high in protein, low in saturated fats, rich in fiber, and no cholesterol. You want to choose unsalted nuts to limit the amount of sodium in your diet. Whole grains, they add extra fiber and nutrients, and there are plenty of varieties from quinoa, bulgur, and tofaro. Salsa, a great way to increase vitamin C, antioxidants, and fiber. This is due to the tomatoes, onions, and vegetables. Dark chocolate. Now, research hasn't yet found the quantity to ease inflammation, but if you enjoy dark chocolate, try at least 70% or higher cacao content. The higher amount of cacao, the lower the amount of sugar. And some food ingredients that can cause inflammation. So, processed sugars trigger the release of inflammatory messengers called cytokines. Saturated fats, they trigger adipose or fat tissue inflammation, which is not only an indicator for heart disease, but also worsens arthritis inflammation. Pizza and cheese are the biggest sources of saturated fats in the average American diet. Other culprits include red meats, full fat dairy products, pasta dishes, and grain based desserts. Trans fats. It is known that it triggers systemic inflammation. It can be found in fast foods and other fried products, processed food snacks, frozen breakfast products, cookies, donuts, crackers, and stick margarines. Avoid foods with partially hydrogenated oils in the ingredients labels. And omega-6 fatty acids. They are essential fatty acids that the body needs for normal growth and development, but excess amounts of omega-6 can trigger the body to produce pro-inflammatory chemicals. These fatty acids are found in mayonnaise, many salad dressings, and oils such as corn, sunflower, grapeseed, soy, peanut, and vegetable. Refined carbohydrates. There are many cereals, white potatoes, white rice, and white flour products. These high glycemic index foods fuel the production of advanced glycation end or AGE products that stimulate inflammation. MSG, monosodium glutamate, is a flavor enhancing food additive most commonly found in fast food and soy sauce, prepared soups and soup mixes, salad dressings, and deli meats. This chemical can trigger two important pathways of chronic inflammation and infect liver health. Nutrition for walking. Before walking, you want to have a meal or a snack that is balanced with carbohydrate, protein, and water. If you are eating within 1 to 2 hours before walking, choose foods that are uh, easily digested and will not cause you any stomach upset. Some examples of balanced, easily digested snacks are low-fat yogurt with fruit and water, oatmeal with low-fat milk, and a piece of fruit and water. If walking less than 90 minutes, a snack during your walk shouldn't be needed. But for walks over 90 minutes, snacks that have carbohydrates are beneficial to keep energy levels up. A general rule of thumb is 20 to 30 grams of carbohydrates per hour over 90 minutes of walking. Easy snacks to carry are fruit, bag of baby carrots, and a bag of snap peas. For after your walk, it isn't really necessary to eat right after, as long as your next meal is balanced with fluids, carbohydrates, and protein. A nice post-walk meal could be salmon, rice, salad, and water, chicken, or another one could be chicken breast, grilled vegetables, bean salad and water, or again, finally, a yogurt and with fruit and granola. Exercising with arthritis. These are the ACSM recommendations. And so, a major barrier for people with arthritis to exercise is the belief that exercise will exacerbate joint damage and symptoms such as pain and fatigue. The fear is not only prevalent among people with arthritis, but also among doctors. But they all need to be reassured that exercise is not only safe, but is also generally reported to reduce fatigue, pain, and inflammation. And there is no clear evidence that people with arthritis cannot engage in high impact activities such as running and stair climbing. But the recommendations for exercise for those with arthritis are pretty consistent for those apparently healthy adults. Take into account, though, the person's pain, functional limitations, disease activity, and the person's exercise preference. Now, the person should start with short bouts of 10 minutes or less if needed, and an adequate warm up and cool down period, about 5 to 10 minutes, are vital for minimizing pain. The activities should include controlled movement of the joints through their full range of motion. Avoid strenuous activities or exercises during acute flare ups. And still important, though, to move those joints through their full range of motion during those flare ups, just nice and easy and slowly. It is also important to let people with arthritis know that a small amount of discomfort in the muscles and joints during and immediately after exercise is common, but does not necessarily mean that the joints are being further damaged. But if pain is higher 2 hours after exercise than it was prior to exercise, the duration or the intensity of the exercise should be reduced. This pain is called DOMS, delayed onset muscle soreness, and especially can happen to those that are new to exercise. If some exercise make worse the joint pain, different exercises can be done that will still work the same muscles and energy systems. It is important to exercise during the time of day that the pain is least severe or the pain medications are at a peak level. Appropriate shoes that provide good shock absorption and stability are key for people with arthritis. And for pool-based exercise, water temperature should be around 83 degrees to 88 degrees for relaxation and reducing pain. Now, how much to exercise? For our recommendations through ACSM aerobic, it's going to be 3 to 5 days a week. Our intensity is moderate to vigorous, and we want to have a total time of 150 minutes a week of moderate intensity or 75 minutes of vigorous intensity. And our type could be walking, swimming, or cycling. Our resistances frequency is going to be 2 to 3 days a week. Intensity is going to be about 60 to 80% of our max repetition, or about 50 to 60% of your max repetition if you're new to resistance training. Our time is going to be about 8 to 12 reps for about 2 to 4 sets. And the type will be either machine or free weight, and then body weight can also work as well. Flexibility, we want to do that daily. And intensity is just to move through the range of motion to stretch without any pain. The time that we want is about 10 to 30 seconds. And again, to hold those stretches, static stretches, those holding stretches. And then the type is stretching focused on all the major joints. Now, exercising with osteoarthritis. Symptoms vary from day to day, and sudden increases in symptoms are called flares. During flares, the lining of the joint capsule thickens and the joint swells. Over time, the progression of rheumatoid arthritis breaks down the cartilage of arthritis, breaks down the cartilage and the bones and the affected joints. Evidence shows, oh, there we go, arthritis. Research shows that cardio and strength exercises help people with osteoarthritis. Exercise helps decrease joint swelling and pain and helps maintain a healthy weight, and this reduces pressure on the joints. And if just beginning to exercise, start with cardio and then build up to adding strength training exercises. We want to start with, we want to select low impact or non-impact activities like walking or swimming. We want to also have a long warm up and a gradual cool down, and this may help avoid additional joint pain. And then divide the activity into many short sessions during the day. Maybe try 3 10-minute sessions to start. And then start slowly and over time increase the intensity and the length of the workout. Take frequent breaks as needed and adjust your workouts based on your symptoms. Now, exercising with rheumatoid arthritis. Now, symptoms vary from day to day, and sudden increases in symptoms are called flares. Again, during flares, the lining of the joint capsule thickens and joint swells. Over time, the progression of RA breaks down the cartilage and bone of the infected joints. Evidence shows that doing both cardio and strength exercises help. And if you are just starting, again, just like with osteoarthritis, you want to begin with more cardio and then add in the strength exercises. And again, it's the same pretty much for osteoarthritis. We want to select low impact or non-impact activities. We want to have a long warm up and a gradual cool down. We can always divide up our activities. We want to start slowly and over time increase the intensity and length of our workout. Again, take frequent breaks as needed and adjust your workouts based on your symptoms. And a couple tips to protect the joints. You want to start slowly. If you haven't exercised in a while, take it easy and slowly increase your exercise length and intensity as you progress. Keep the impact low. Low impact exercises help keep the joint stress low while you move. Also apply heat. It can help relax your joints and muscles and relieve any pain you have before you begin. Should be warm, not painfully hot, and should be applied for about 20 minutes. Our next one is move gently. And you want to start moving your joints gently at first to warm up, and a set of stretches for 5 to 10 minutes before you move on to cardio and strength exercises. Going slowly. Exercise with easy and slow movements, and if you feel pain, take a break. Slow down if you notice swelling or redness in your joints. And then ice afterward. Apply ice to your joints for up to 20 minutes as needed after exercise. And again, we want to follow that 2-hour pain rule. If you feel more pain 2 hours or more after you exercise than when you began, you were probably exercising too hard and then need just to pull back on the intensity or the time. So in the end, exercise is an essential part of the treatment plan for those with arthritis. It will strengthen the muscles around the joints, help you maintain bone strength, give you more energy to get through the day, make it easier to get a good night's sleep, help you control your weight, enhance your quality of life, and improve your balance. Joints, some classic signs and symptoms are joint stiffness and pain, and regular physical activity, including aerobic or cardio, resistance, which is strength, and flexibility will reduce pain and decrease stiffness. Even though we might think that exercise will worsen arthritis symptoms, the lack of exercise will actually make our joints even more painful and stiff. Keep building up the muscle is vital for maintaining support for your bones. Weak muscles create more stress on your joints. Again, our exercise prescription is the same, but you want to adjust, the same as for healthy adults, but we want to adjust for our pain, stability, and functional limits. Now, our goal is to stay active and find the activities that we enjoy and to keep with it. Thank you for listening to this presentation. Uh, have a great day.